This video will review the characteristics of coupling mechanisms for ostomy pouching systems. Pouching systems are either one piece, where the pouch and barrier are welded together and cannot be separated, or they are two piece, where the pouch and barrier are separate and joined together through some sort of coupling mechanism. These mechanisms have a variety of properties that should be considered when selecting them for your patients. These properties include the impact on cost, as two-piece systems always cost more than a one-piece, the profile or how far they stick out from the body, how flexible they are over the body contours, their flexibility in pouching styles, whether you can actually switch to smaller pouches, caps, or containment devices, as well as the ease of coupling, whether you can add a pouch, remove the pouch, or burp without spillage, and the pressure that's required to add the pouch and use postoperatively without considerations of pain. Think about the types of securements and their ease of use, the ability to ensure that there's no leaks from the coupling mechanism once you put them together, and the ability to retain the shape under stress from a belt. We will review the commonly available coupling mechanisms looking at their individual merits and concerns. On the whole, one-piece systems are cheaper than two-piece systems. One-piece systems can range in price from $5 to $15 each, where the barrier for a two-piece system can range from $8 to $22 each, and the adjoining pouch can be anywhere from $3 to $17, making the total cost of a two-piece system anywhere from $11 to $39. One-piece systems are known for their flexibility, their low profile, and their ease of application. So when you look at the back of a pouch, you can see that there are some benefits, such as how flexible it is for the entire pouching system. You want to think about whether or not they have extended wear barriers or regular wear barriers, and whether the types of drainable options. Two-piece systems are known for their versatility, your ability to switch out pouch styles in a day, and the ease of burping, your low to high profiles, and varying degrees of flexibility versus rigidity. Each of the two-piece systems will be reviewed now for their properties. It is important to note that there is no universal language for describing or grading these coupling mechanisms, and most of the descriptors come from clinician experience. We're going to look at things like their profile, their flexibility, in terms of how they would mold over pouching or over body contours. We would think about their flexibility in terms of switching to different pouching styles. Again, that ease of coupling, your ability to add the pouch, remove the pouch, burp, etc. So the first system that we're going to look at is from Coloplast. This is their system called Sensura Click. As you can see, that there's a raised round rim here, and that the belt tabs are actually on the flange itself. The pouch has a ring that actually secures through a little lock up at the top here, and that lock is what tightens up around the outside portion of the ring on the barrier here. So to unlock it, you actually put your finger in the middle here, and you can see that it unlocks. And how you would actually attach is to start at the bottom and push the ring in place all the way around. You can almost hear a click. When you have it in place, you can actually move this locking mechanism wherever it is that you want, what's easier for the patient. And then, in order to ensure that it's secure, you actually squeeze it together. If you need to remove the pouch for any reason but still want to keep the flange in place, you put your finger in place and you hold the pouch and remove it. So some of the considerations for this particular system, once we actually have it locked and in place, is that it's actually fairly rigid. If I wanted to have a body profile that needed some flexibility, either a crease, or if I wanted to try and place it over a rounded pouching system, I'd have a very hard time. That's incredibly rigid. It also has a fairly high profile when you look at it from the side. And some people may find that that's actually quite challenging or difficult underneath their clothes, that would be harder for concealment. Some people find that this mechanism here to unlock it can sometimes again be very difficult, and they also find that when they want to go and remove it is that there is a little tab up at the top here, and sometimes when you pull that tab you actually can break the entire coupling mechanism, so it's actually easier or better to hold the entire pouch from the top to remove it. Because it doesn't always necessarily snap, you may not know that whether or not you've actually got the pouch in place before you try and lock it. In general, if you're having difficulty putting this together, you're probably not having the pouch attached properly to the coupling mechanism. One of the things that you want to think about with the Sensura Click is whether or not you could actually do burping. While some of the pouches actually have filters up at the top, sometimes people want to be able to remove the pouch ever so slightly to just remove the gas. And that's actually quite challenging to do with this one. It requires a lot of stability. You need a fair amount of force with your hand here and being able to pull it apart. And it's hard to actually pull it without getting a large release of the actual coupling mechanism. So this one's a little bit more challenging as far as burping goes. And as I said, it may be a little bit harder for individuals that are elderly to be able to actually push this together or to actually find the spot to be able to release it. And individuals that have poor sensation in their fingertips as a result of chemotherapy may find again that this is really quite difficult for them to manage. This particular pouching system is a little bit different in the fact that you've got the belt tabs off to the side here and on the flange, so you're not so worried about distorting the actual coupling mechanism under the pressure of a belt, and so that is a good feature. The other feature or the other mechanism that Coloplast has available is their other system called Sensura Flex. And this one is somewhat similar to Post-it notes in terms of its application. So you have something here that's almost like a landing pad. And you can see that there are no belt tabs on this particular one. Because it is quite a flexible system, you can see that the coupling mechanism means that you don't have the same rigidity as you did with the Sensura Click. So you have a little bit more flexibility, but because of that, you lose the benefits of the belt tabs because the belt tabs would actually pull and distort the barrier. So what you want to do with this one is you take the backing off of the pouching system like this, and probably the best way to try and put it on is to actually fold it in half like this, and to line up the lower half at the bottom, attach it, and just fold it over the top like that. And then you can see that you've actually got a fairly low profile and that you retain the flexibility of the system. The idea is that you are actually able to pull this apart and burp it again, but again, it can be a little bit challenging and difficult for people who have poor dexterity or strength. It does require that you stabilize the barrier against the skin and pull this tab away. There is a limited number of times that you can actually release this and that it retains the tack. You'll notice that when on the back of this particular pouch is that you've got these little extra channels here, and what that does is ensure that if you have a wrinkle when you're actually applying it, is that the stool would actually run along the channel as opposed to wanting to seep out to the side here and causing a leak. Wrinkling is one of the challenges with these adhesive coupling mechanisms, is that if you don't get it exactly flat, is that you can actually get a wrinkle, as I said, and that the stool may want to seep out to the side and you have odor or breakthrough. And the other challenge is that if you do actually try to pull it apart to burp it and you get this particular landing pad wet, is that of course, because it's like a Post-it note, is that you're not going to actually get any tack, and so you would actually lose your seal. So some people prefer again to not actually burp with this particular product because they don't want to lose the seal. The next set of coupling mechanisms we're going to talk about are from ConvaTec. So the first one we'll do here is called AutoLok, and AutoLok has been probably one of their older systems. I think it came out in the 90s. And as you can see, is this one's actually got a fairly high profile to the side, and it is extraordinarily rigid. There's absolutely no mobility to this whatsoever. You can see that it actually has a little device up at the top here, and you can almost see that ring coming out to the side there. And what that does is it releases the grips that are actually on the pouch. The beauty of this particular system is that it's actually very easy to apply. So you have this ring that needs to sit inside of that coupling, and all you have to do is, once you've lined it up, is that the pressure of your hand, you can hear the click, will actually get it into place. When you want to take it off, this little mechanism up at the top here, you can either turn it to the right or to the left, and you pull the pouch out, and it is very easy to remove. The other option that some people prefer with this particular pouching mechanism, once it's on, is that it also gives you the option of being able to actually turn the pouch into different directions without actually having to remove the entire system. So some people like this for their urinary pouches because for use at nighttime, is that when they want to place it to straight drainage and they prefer to have that off to the side, that they can do that. Or for your post-op teaching, again, if you want to have it off to the side for emptying into a container, or you're actually getting somebody up to the bathroom to empty it, is that you can actually reposition it. Okay, but again, it is extraordinarily rigid and doesn't have a lot of flexibility. I believe that they still have convex inserts, so that you would actually place an insert on the inside here to give you a nominal amount of convexity on the back. But this is great for individuals who have very poor dexterity or strength, because they can actually do it with the palm of their hand. The next coupling mechanism from ConvaTec is called their Sur-Fit Natura. And this is probably closest in comparison to something like Tupperware. So you've got this raised area here, and you can see on the back of the pouch is that you've actually got the groove, and the two of these mechanisms are going to snap together. And you may or may not hear the snap with this one. Sometimes if you're counting on a snap as a cue for the patient, sometimes it doesn't actually do that for you. So it has probably a medium level of profile for underneath the clothes, and it does have belt tabs on the pouch here on either side at 3 and 9 o'clock, and then you've got this extra little tab up at the top here that's used for burping. So the burping you would actually pull aside here, and you can just release the gas, and then you would snap the two together. It does take a fair amount of pressure to be able to apply that, so it can be somewhat challenging for use in post-op situations. Patients may find that there is actually quite a bit of discomfort. So you have two options for that. One would be to actually put a little bit of liquid soap right along the rim here before you apply it, and what that does is act as a lubricant, and so when you attach this, you're actually decreasing the amount of force that's required to attach the two together. The other option is this post-op adapter that is available, and so what you would utilize is, or what you would do is apply this before you would actually attach it to the patient. You would apply the adapter, and what it does is create a raised area for you to be able to put your fingers underneath, so that when you're attaching the pouch like this, is that you're not actually putting any pressure on the abdomen itself, and you're able to reduce the discomfort that's for a patient. The downside of that, of course, is that it raises the profile considerably for the individual, and so that may be distressing for them or concerning, particularly in the early post-op days when they're worried about understanding what a pouching system means for them. You can collapse it a little bit, but it doesn't always want to stay collapsed, and it still has a fairly high profile even when it is collapsed. It is great for the elderly when you're trying to teach them how to attach it, and for individuals in particular that are using closed-end pouches, because again, with that frequent removal, is that it's just an easy place for them to get their fingers until the post-op pain has subsided and they feel more comfortable to apply it directly onto the flange itself. The last coupling mechanism from ConvaTec is called their Esteem Synergy. So this is their version of an adhesive coupling system, similar to the Coloplast Sensura Flex. And you can see again is that there is some sort of a landing pad here. It's a clear plastic. And the beauty of this one is that it's just like the Flex, is that it gives you the option of a two-piece system, but it has a very low profile when you see it from the side. So exactly the same idea is that you would pull this apart and you would fold it in half, and you would apply it to the back or to the landing pad, and you would fold it over top like that. And again, you'd have the same issues related to burping, although this one is slightly easier to pull apart, but you can also see that there's no channel right here. And so what happens is if you do get wrinkles in here, that there's no mechanism or delay for the stool to get into those particular channels. And so you will actually get stool or odor coming out through that particular wrinkle. And again, there is a limited number of times that you can actually pull this apart if you're using that mechanism for burping. And again, if you actually get wetness on the landing pad, then this is not going to stick and you're going to have issues related to leakage. It's flexible, like the other system was. You can actually see it curving over body contours. And again, it gives you that flexibility of being able to switch out a pouch. Sometimes people want to leave the flange on and change the pouch on a daily basis, so that gives them that option. Hollister has two mechanisms for their coupling. Their oldest one here is called CPL, or center point lock. And so again, it looks somewhat similar to what you saw with the Natura Sur-Fit from ConvaTec. It's just like Tupperware. It has a slight difference in that it has what we call a floating flange here. So it's a place for you to put your fingers, so again that you're not pushing directly on the patient's abdomen. And what you want to do is be able to line up the two. I usually tell the patients to start at 12, and then they can bring their fingers all the way around and push the two together. Again, you may or may not hear the snap when you attach it. It has, again, the belt tabs at 3 and 9 o'clock, but there's the extra one up here at the top if they want to pull it apart to actually burp. And it is quite stiff. I find it actually quite challenging to be able to pull it apart for that. And it requires a lot of stability with your hand on this side to be able to hold the flange in place so that you can actually pull it apart. And then you want to snap it together. The floating flange, one of the things that it's great for post-op, but one of the things you do have to be aware of is that when you have a convex barrier, when you've got a bump on the back here, is that it actually leaves you less room for your fingers underneath. And so it may be a little bit more challenging for individuals to put that together. Again, the profile is quite high. You can see, and sometimes with the weight of the stool is that it actually will pull away from the top there, and you can see that it actually raises the profile, and it's fairly rigid. Although the rigidity is actually in the top part, and you can see that the barrier itself has actually got a little bit more flexibility. So it will go over curves on a belly, but you will still have this raised area or raised profile. They're newish, I guess. This has been out on the market for quite some time. This is their new image version of their coupling mechanism. So you can see that this one's actually quite a bit smaller. And when we put the two together here, there's much more of an audible click, and you can see that there's actually quite a bit of a difference in terms of the profile from the side, so it doesn't stick out as much. It also has a floating flange, but it doesn't pull away nearly as much as the CPL. And the same feature that when you have a convex barrier is that you actually have less room underneath. You have the same belt tabs on either side, and you've got the little one up at the top here to be able to pull it apart and be able to burp the pouch if you want to do that. The one thing you do have to note, and one thing I didn't talk about with the other coupling mechanisms, is whether or not they actually retain their rigidity with or their coupling, their actual coupling with the use of a belt. And most of the pouches that have it actually do retain their integrity, meaning that when you actually put the belt tab on the side here and you've got it stretched around, is that the pouch stays attached. You have to be careful with new image because it actually can distort the pouch, and it pulls it off to the side, and you'll find that sometimes it wants to lift exactly where the belt tab is attached here to the barrier. That doesn't tend to happen as much with something as rigid as CPL. You can actually have a fair amount of force pulling on either side with a belt tab, and it's not actually going to distort the pouch at all. The adhesive coupling mechanisms like this one here, you'll have to take note of the fact that, again, they don't have actually any belt tabs. You're not going to be able to distort that in any way or have the benefit of a belt if you feel that that's needed for the patient. The last coupling mechanism that we have is from salts, and they only have one coupling mechanism, and it is an adhesive coupling mechanism. So the same idea as what you've seen with the Flex and with the Esteem Synergy. It is a barrier with a landing pad of some sort here, okay, and you've got your pouch that has like the post-it note sort of stickiness on the back of it. You will notice that, I'm not sure if you can see that, there's a bit of a raised area here, and what they have done in answer to concerns from the other adhesive coupling is that some people find it difficult to actually line up the pouch before you attach it, that they're not sure that they have it in the right place. So the idea behind this little raised area here is that you've got a notch in the apply or the pouch itself, and that you would actually line that up there before you apply it so that you know that you've got it in the right place. There is no tack in that little blue zone here so that you can actually line it up without having to worry that you've actually got it attached. And once you know that you're sort of sitting in that notch, is that you can fold the pouch over top again, and so that you have the adhesion. Same concerns as with the Esteem Synergy is that you don't actually have the channels on the inside here. So again, if you don't have it perfectly flat and you have a little wrinkle, is that potentially you've got concerns of odor or leakage. It is a little bit easier to pull this apart so that if people wanted to burp, they can do so, but remember you have to try and keep the landing pad dry. If you require more information about coupling mechanisms, contact Joe or the customer service lines for the major suppliers in Canada.